speaking of a golden ticket, if you'd like a golden smile, one that everyone goes, wow, that is a pretty smile, Dr. Larry Stroud is the answer here. He is to my left here. And doctor, it's interesting because a lot of folks just aren't happy with their smile. And you know, I don't think anyone, whether it be a little one, adult, no one should go through life not feeling confident about smiling and laughing and feeling good about life, but it happens, doesn't it? It's kind of sad.
All the time. I mean, just like ours that wouldn't even go out of the house for years and years and years. And I've had other people in you know, other places like that too that have gone years and years and years and hating their smile or their teeth rotted off, like the one fellow that called in. And you know, people come in and they're talking like this, you know, and because they've been embarrassed all their lives. In fact, you know, it's called a long time. And then you know, then when they get teeth back and they can smile, they just can't believe it. Well, in fact, it's hard for some people. It's hard for some people to learn to smile again.
Yeah, I bet it is. I bet it is because you've done it for years. It's like, guess what? It's okay to feel good about that. Yeah.
I'll say, you know, you got to smile now.
Yeah, guess what?
They're just so used to, you know, it's strange for them that they can actually have their smile back.
That's sad, but you're doing good work. I'm telling you. Let's talk to Lisa, who is joining us now. Lisa, welcome to Wave 3 Listens Live.
Hi.
Hello, Lisa.
Hello.
Go ahead.
I was curious if
Go ahead, Lisa. Yeah, don't listen to the television.
I'm not. Okay, I was curious if you had bone loss, if you could still get them.
If you have what?
Like some bone loss?
Oh, bone loss. Oh yeah, that's always a big question that comes up with people a lot is bone loss. And the nice thing about the mini implants is, you know, they're kind of like long, narrow screws. And the way they're placed is it's so minimal. It's just a small hole and then they're screwed in. The surgical implants, you know, is a lot of cutting, a lot of drilling the bone away. They have to have a large mass of bone to do the surgical implant. With the mini implants, it's not so. And I can actually put them in places where there's not a lot of bone. I don't have to have a lot of bone, I just have to have some bone. And actually, I've done this on so many people we've talked about before that have been told that, you know, they don't have enough bone or they wouldn't be a candidate for any kind of implants that the surgeons have told them. And we've done the mini implants for them. So it's a very rare occurrence for me in my office when I have to tell somebody that I just don't think we can do anything there. It's very, 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 very rare. And it's just because, you know, we can do this with the mini implants where there's not a lot of bone. So. Okay. Most people are candidates.
All right, that's good to hear. So how often, you said very, very, very rare, how many cases has that happened when someone came in and you go, I can't help you?
Well, I'm sure it's not even, I doubt if it's even once a month that may happen.
So it's very rare.
Of all the people I see.
Yeah, wow.
Very rare.
All right, let's go to Teresa, who is with us now. Teresa, good afternoon. Welcome to the show.
Hey, good afternoon. Thanks for taking my call.
Hello?
My question, Doc, is I love my smile, but I have a natural gap.
Uh-huh.
And I was wondering, can you do the implants and still like have a gap, you know, just still that natural look? Had it all my life, so I really like the gap, but I wanted to maybe do something different. My smile is crooked. The two front teeth, they're kind of crooked, but again, I like that gap. So
I got
just wondering if you could do that.
I understand. Yeah, a lot of people have that gap, you know, and they've had it all their life, and it's just, you know, it's just like it's part of you, right? I mean, it's just you. And so, you know, that's kind of a common thing, and we've done that for a lot of people. And, you know, the answer is sure you can. You know, we can plan it that way to still have, you know, a space between the front teeth. Sometimes it's even little different kind of things where a tooth might be turned or shifted one way or another to look, to have a particular kind of look instead of just lined up perfectly. So, you know, there's a lot of things like that we've done that people want to do. And sure, that's no problem to do.
Yeah, Teresa, don't change your smile. We love your smile.
keep your look, keep your gap.
Keep you, that's right. Let's grab Spencer's call real quickly. Spencer, welcome to the Wednesday show. How are you, Spencer?
I'm fine. How are you?
We're doing well. You have Dr. Stroud.
Yes, doctor. I have false teeth.
Uh-huh.
And they don't fit my gums. And I went to a dentist in Seymour, and he set me down in the chair for 5 minutes to try to get them lined up. But he never did get them to where they fit. I can't even wear them no more. I haven't worn them in 2 years.
Right.
And I'm just wondering what it would cost to get them realigned or fixed permanently in my mouth, because the first set I bought I had anchors. in my 4 bottom teeth. They
Right.
say 4 teeth.
Right, you had a couple teeth left, right?
Yes, but
They
I
helped
don't
hold it
got
in.
them no more because they pulled them.
Right.
And I just don't know what to do anymore because I don't want to buy a new set of dentures at $1,800 that I don't have.
Well, the most economical thing that we do, Spencer, is where we put implants in so that your dentures will snap in and out. Now, maybe we could use the dentures you have. If everything is good with them, they have to be fitting well. The fullness of your mouth has to be right. The bite has to be right. We got to check all those things because a lot of times they're not. A lot of times, you know, people have had so much bone loss and we have to build their mouth up and make sure their mouth is filled out right so their smile looks good and their lips are supported good. There's a bunch of things like that to consider. So sometimes we can use a person's dentures, but a lot of times we make their dentures again. But the bottom line is the most economical thing that we do is where your dentures can snap in and out. And we've shown that before. You're wearing dentures, but the implants hold them in good where they snap in. You don't have to use adhesive. You can eat what you want, and your teeth stay in. And I started doing that because years ago the only alternative was to go to the surgeons and go through a couple of pretty significant surgical procedures, and they do a thing where your dentures will snap in and out, or actually kind of screw down on your gum is the surgical procedure. You go through a bunch of surgery to get there. Costs about $30,000. This is with the surgery way, not what I do. The mini implants will come along, and that lets me do this thing where your dentures will snap in and out for probably about a third of that, or maybe a little more than a third of that. So that's what's made it so popular. It's just easier for people to do, and it costs less.
All right. We have to run. Call their office, free consultation. We'll be right back. Larry Stroud, Mini Dental Implant Center of Louisville. We'll be right back.